Hi, I'm Dr. Dellaria. We're going to show you how we're going to use the brimhall adjuster today. This is the instrument. This is what it feels like. It lightly adjusts the bones back into place through a series of impulses, different than a manual adjustment which would bring the bone back in one impulse. So we find the vertebrae that are misaligned and adjust them back into place. And we have motion where we didn't have motion before. Some areas can still be tender, but for the most part, it's pain-free. Okay, and did that hurt at all?
No.
Okay, so that's using the brimhall